Have you noticed that when you try to raise your arm, it only goes so far before that familiar pain or tightness forces it back down? For many seniors, that limitation keeps getting worse year after year. Not always because the shoulder is beyond repair, but because the one movement pattern that can actually help is rarely explained the right way. The biggest mistake is treating every shoulder problem like it is the same. It is not. That is why so many people rest, stretch, or rub the area for months and still never get real relief. The shoulder is one of the most mobile joints in the body, and that also makes it one of the easiest joints to irritate in different ways. So before doing random exercises, you first need to understand what kind of shoulder pain you are dealing with. In today's Senior Health Tips, we are going to go through 3 simple self-checks and then match each one with the right exercise approach, so you can stop guessing and start helping the exact problem that is limiting your movement. The first pattern shows up when the arm hurts most during the middle part of lifting. Let your sore arm hang relaxed by your side and slowly raise it straight out to the side with your palm facing down. At first, it may feel okay. Then somewhere near the middle, you may feel a sharp catch, pinch, or ache. But if you keep going a little higher, that pain may ease again. That pain in the middle pattern matters. It often means the tissues in the shoulder are getting compressed during that part of the movement. This is the kind of pain many people feel when reaching for a cabinet, putting on a jacket, or lifting something from the counter. If that middle range pinch feels familiar, the first goal is not force. The first goal is space. Start with a gentle pendulum swing. Lean forward slightly with your good hand supported on a table or chair and let the sore arm hang loose like a rope. Then make small, relaxed movements, forward and back, side to side, and tiny circles. Do not swing hard. Let gravity do the work. This helps create a little room inside the joint without asking the irritated tissues to work. After that, do table slides. Sit at a table with a towel under your forearm and slowly slide the arm forward until you feel only a light stretch, then return. Do not push into real pain. The table supports the arm, which makes this much gentler than lifting it in the air. Then add shoulder blade squeezes. Sit tall, let your arms relax, and gently pull your shoulder blades back and slightly down. Hold for a few seconds, then release. This may look simple, but it matters because the position of the shoulder blade affects how much room exists in that painful zone. The second pattern is different. Hold your arms slightly forward and slightly out to the side. Then turn your thumb down like you are pouring out a can. From there, try to hold the arm up while pressing down lightly with your other hand. If that brings pain to the top or front of the shoulder, or the arm feels weaker than expected, that points to a different issue. In many seniors, one specific shoulder muscle becomes irritated and weak at the same time. When that happens, even ordinary tasks like reaching up, washing your hair, or pulling on a shirt can feel harder than they should. The mistake here is trying to strengthen too aggressively too soon. First, the muscle has to be challenged safely. Start with wall slides. Stand facing a wall, place both forearms on it, and slowly slide them upward as high as feels comfortable, then come back down. The wall supports the movement and gives you feedback, so it is much safer than forcing a raise in open space. Stay in a range that feels controlled, not painful. After that, use an isometric wall press. Stand sideways next to a wall with the sore shoulder facing it. Bend the elbow to 90 degrees and gently press the outside of the elbow into the wall as if trying to lift the arm outward, but without letting anything move. Hold briefly, then relax. Start with light effort only. Do not press hard. If it feels okay for several days, you can slowly increase the effort. With this kind of shoulder problem, patience works better than intensity. The third pattern often shows up when rotating the arm outward. Keep your elbow bent and tucked against your side, then try to turn the forearm outward. If that causes pain along the outer or back part of the shoulder, or it feels clearly weaker than the other side, that points to another common weakness pattern. This is very common after 60 because daily life constantly pulls the arms inward. Driving, typing, cooking, carrying things, all of it encourages the shoulder to roll forward while the muscles responsible for outward control get weaker over time. To begin improving this pattern, use assisted outward rotation with a stick, cane, or broom handle. Hold it with both hands in front of your body, elbows bent and tucked in. Use the good arm to gently guide the sore arm outward while keeping the elbow pinned to the side. Only move as far as feels comfortable. Keep it small and clean. Do not twist your body to fake extra range. Then, do an isometric outward rotation against a wall. Stand with the sore side near the wall, elbow bent and tight to your body, and press the back of your wrist outward into the wall without allowing movement. Hold, then release. Again, start lightly and build slowly. For the next 7 days, do not try to fix all 3 patterns at once. Identify which test feels most like the pain you deal with in real life, and focus on those exercises once a day. Then retest the same movement after a week. If it feels even a little easier, that is progress. If not, reduce the range, slow down, and make sure you are not pushing into sharp pain. The goal is not to force the shoulder. The goal is to rebuild movement safely and consistently. Small daily work done the right way is far more effective than doing too much and flaring the shoulder up again. If your shoulder has been limiting how you move, start with the test that matches your pain and build from there. This can be the first real step toward getting your arm moving more freely again.